Hello, everyone. Thank you for tuning in. My name is Dimitra Trejo, Communications Manager for the UTRGV School of Medicine. Today, we have with us Dr. John H. Krouse, Dean of the UTRGV School of Medicine and Executive Vice President for Health Affairs. We are going to be participating in a Q&A with Dean Krouse in regards to COVID-19 and the changes we've seen in the last couple of weeks. Dean Krouse, thank you for being with us today.
Well, thank you, Dimitra, and it's good to be here this morning. Happy to be joining with you for this conversation.
All right, so now we're just going to jump into this Q&A. So the first question is, how do I know if I need to be tested? And if I do need to be tested, what is the proper procedure to do so?
Well, we're currently testing, Dimitra, people who have symptoms for COVID-19. So in people, for example, if they have a newly developed cough, if they have fever that's come on rapidly, if they're short of breath, especially if they've been around someone that they know is positive for COVID-19, then those are the people who we really would prioritize to be the ones that should get tested at that time. We also would recommend that people who know they've been exposed to those with COVID-19 monitor their symptoms. And if they begin to develop anything that suggests that they may be having one of those symptoms we've talked about, then at that time, I would suggest that they get tested. So in those cases, what we would like to do is have those individuals contact our patient care center at UT Health RGV. And that can be done either through our website, where they can fill out a form on the website at uthealthrgv.org/coronavirus. And then that will be monitored and processed by our team at the patient call center, and they will be scheduled for an appointment. Or those who would like can certainly call our patient care center number directly, which is 1-833-UTRGV-MD, also 1-833-887-4863.
Thank you, Dean Krouse. The second question is, during this spike in COVID-19 cases, how can I keep myself and others safe?
I think the main thing to do to keep safe is to follow the CDC guidelines, follow the governor's recent guidelines, and there are several, and they're fairly simple and straightforward. First of all, it's important if you're around anyone to wear a mask or a face covering. This, we know over time, has been demonstrated to reduce the spread of disease. Not only helps to prevent you from contracting the virus yourself, but we know there are people who do not have symptoms who can spread the virus, and wearing a mask helps you to then protect others who might be exposed. So wearing masks or face coverings is a very important thing to do. Maintaining social distancing of 6 feet. And we know that the virus transmission occurs more readily in that first 6 feet between people. So 6-foot distancing is important. Hand washing. We know that the virus will live on surfaces for hours perhaps. And if you're touching surfaces, doorknobs, elevator buttons, things of that sort, it's very important to use a hand sanitizer right after that. Important to wash your hands with soap and water. And we do know that just soap and water will kill that virus after about a 20-second use of that soap and water. And then avoid large crowds. Clearly, if you are in large gatherings, you are more likely to either contract or spread the virus. So good guidance suggests that you should not congregate in groups of larger than 10 people.
Thank you. The next question is, does wearing a face covering really keep me and others safe? And if so, how do I properly wear one?
Yeah, and thanks again, Dimitra. That's a good question. We have really learned over the last several months that face coverings dramatically decrease the spread of the disease. And there's ample evidence from a variety of good scientific studies, from clinical experience, that despite what others might say, face coverings do decrease the spread of the disease, do decrease the amount of the virus in the population. So absolutely, face coverings are important. It's important when wearing a face covering, and that can be a formal mask or a bandana or a cloth around your face, it needs to cover your nose and mouth at all times. We've seen people in stores, for example, that wear it around their mouth, but their nose is exposed. Well, that's again defeating the purpose, because you will be expelling virus through your nose as well. So when you are wearing a mask or a face covering, make sure it covers your nose and your mouth at all times.
The next question is, if the phone screening determines that I need to be tested for COVID-19, What do I do while I wait for my test appointment? What do I do while I wait for my results? And what do I do if the results are positive or negative?
Okay. I think the main thing to realize here is that if you are exposed to someone who has COVID-19, we would strongly recommend that you self-isolate for 14 days, meaning that you avoid being in public, you avoid contact with others for a 14-day period. The reason for such a long time is we know that some people will develop COVID-19 7, 10, 12 days after they've been exposed to the virus. So shorter periods of isolation just do not capture those that might develop late symptoms. So you need to stay home, you need to avoid contact with others, you need to isolate yourself. And when you get your test results, again, one single test result, if it's negative, might not be negative 3 or 4 days later. So that's why, again, the 14 days is important. If you do test positive, we recommend that you coordinate your care with your primary physician, or again, you can contact UT Health at the numbers I gave earlier, and we can provide a physician for you. But go by your physician's guidance for treatment. There are a variety of treatments that do make sense. There are some that are out there that have been disproven. So your healthcare provider really is the right one to guide you through the process if you do test positive.
And it's important to know, just a side note, we've just been seeing a lot of people say, well, I saw on Facebook that, face coverings are bad, or I saw that you can only stay isolated for like 7 days. Like, what do you say to somebody who may be getting their information, not from their medical provider, but from social media?
Again, that's just incorrect information. And again, on the internet, there's no vetting. There's no examination of the quality or accuracy of the content that's there. Again, we're following evidence. We're following the guidance of science. We're following the guidance of the Centers for Disease Control. And they all are now saying, even up to, again, Governor Abbott in Texas, face coverings are important. They do decrease the spread of disease. And isolating, again, if you are positive, you need to stay out of contact with others. It makes sense, and the evidence does support it.
Thank you. The next question is, okay, I've been tested at one of the 4 UT Health RGV COVID-19 drive-through testing sites. How do I obtain my results? Will someone call me directly?
Demetra, if you do test positive, then absolutely you will be called as soon as we receive that positive test result. And we are finding that we are returning those results within 24 or at the latest 48 hours. So rapid turnaround, but realize we are testing today 1,200 people and probably in the next days significantly more than that. So we're not calling all people who have negative results. Now, if you have a negative result, all of the results are being placed in our patient portal in our electronic medical record. And at the time you're tested, you'll be given information of how to register for that. And you can go online simply, you can register yourself for our electronic medical record patient portal. And as soon as that result is available, it will be posted there. So again, all positives, we will give you a call. We'll let you know if you are positive. Everyone, whether positive or negative, will be posted in this patient portal online.
Awesome, thank you. The next question is, who is now considered high risk for COVID-19, and how has the high risk population changed over the course of this pandemic?
I think there's been a little bit of a change early on, and we certainly do realize that the individuals who have the worst symptoms, the worst severity, and the highest risk of death are those that are elderly. We're seeing that in nursing homes. We're seeing that in our own experience here now in the Valley. So early on, it was realized that 65 years of age and older did provide what appeared to be some increased risk. That has not changed in the sense that we know that's true, but we've eliminated now the age as a sign of severity, because we know that all people at all ages can get serious illness. We know that young adults can be extremely ill, can be intubated in the hospital, can die. So that the age really is not the important factor anymore in determining whether or not someone's at risk. We do know, though, that obesity is a risk. And in fact, even mild obesity has been shown to be a risk in recent studies. So we know also in the Rio Grande Valley that obesity and diabetes are at higher rates here than in many other parts of the country. And diabetes has been seen as an increased risk remains as an increased risk, and so does heart disease. So they've changed a bit. We know that it's not a disease that's restricted to the elderly, that people, even young adults, can have serious symptoms. And it's important then to try to get your weight under control, to try to get your blood sugar under good control if you're diabetic, and just do things in a healthy lifestyle that will help you to have less risk of serious consequences should you be infected.
The next question is, how long is the current wave going to last? How long is this pandemic going to last? And should I be worried?
I think that's an excellent question, Dimitra. We're not out of the first wave. The wave that started for us back in March is still continuing, and unfortunately it's worsened dramatically here in the Rio Grande Valley. We would expect this wave to continue through the summer. Hopefully now that people realize the severity and we're going back to good hygiene practices, that will drop off over the next month. But I think we should expect that the waxing and the waning of COVID-19 is going to go on for probably some years. We know that we've come to live with the seasonal flu. We get flu season and people get vaccines for the flu each year, but some people still get sick. Remember that COVID-19 is a coronavirus. It's a virus that's very similar to some of the common cold viruses. And we know that those common cold viruses wax and wane as well over time. So I think in some ways, COVID-19 is here to stay. And I don't say that in a way to frighten people. I say that in that as we find good treatments, as we get vaccines available, then the severity of the disease will be less. The likelihood of a bad consequence will be less. So I would not be afraid, but I'd be very careful and cautious. We know, as we spoke about earlier, that if you're careful, if you wear face coverings, if you practice social distancing, you will significantly decrease the risk that you will contract coronavirus or that you'll spread it to someone else. So fear is not the word that I would want to use, but just be cautious, be diligent, be careful, and really use common sense when you're out in the public. If we do that, I think we're going to all be able to come through this in a way that's going to be satisfactory and keep us as safe as we could possibly be.
Thank you, Dean Krouse. The last question is, what can UT Health RGV do to help during this time?
Well, UT Health RGV has been very active in combating coronavirus. Early on, we set up testing. We've been doing testing now since late March. We continue to be the largest single provider of tests in the Valley, not only for direct patient sampling, but also for our hospitals and medical centers. We continue to operate over 20 sites, care sites across the Rio Grande Valley, from here in Hidalgo County all the way to Laguna Vista. So we have a number of providers at those sites who are available to take care of people, and we'll continue to do that. We'll continue to take care of people if they are positive and don't have a provider. They're certainly free to contact our personnel, and our physicians will take care of them. And also, we're widely using what's called telemedicine now, which means that people do not even need to come into the office. We can do a Zoom appointment or an appointment by a virtual format where that patient can be examined, the history of that patient can be taken, we can see how they're doing, and our physicians and health providers can provide treatment for them or recommend that perhaps hospitalization might be necessary if the symptoms get severe enough. So we are operating full-time. We have people across the valley to take care of you, and UT Health RGV is here for you because your health matters to us, and we're here to take care of you.
Awesome. Thank you so much, Dean Krouse. This concludes our Q&A. We want to thank you for taking the time to sit down with us and answer some of these questions, because we know that the situation is very fluid and people are very concerned and they have a lot of questions. So we want to thank you for taking the time to sit down with us. Do you have any last comments for someone who may be watching this video clip?
Dimitra, absolutely. What I always say is stay safe. This is our responsibility. It's our joint responsibility. All of us have a role in this. By taking care of ourselves, we take care of others. By practicing social distancing and face covering, we protect not only ourselves, but we protect others. And it's this mutual responsibility that we all feel together as a community that's going to get us all through it. So be careful, be safe, practice those good hygiene policies.